Great, welcome everybody. Gonna go ahead and call us to order for our main board of health meeting. I hope everybody had an enjoyable long weekend. That was probably well deserved for everyone. So welcome back to work, the work day. Okay, we have no one for privilege of the floor, so I'm gonna go ahead for approval of the minutes. So looking for a motion to approve as written. I have a first from Shauna, a second from Ravinder. Any discussion? Changes? Okay, all in favor is written. We are unanimous. I will turn it over now to Jeremy for our financial summary. Hold on.
So last month we showed you the year end, and there wasn't anything significant, we didn't go over budget or anything like that. This next one that you're seeing is through the end of April. Again, most of our claims for the state money or the federal money is now being processed. So some of that is not hitting our books yet. So we're sort of in midstream on that one. We are currently preparing for our budget for this year, and it's going to look just a little bit different in that the ledge is going to have a second retreat in July. So we're going to do a maintenance of effort budget this first round. Then in July, they'll have a lot more information, hopefully. And if we have to make any adjustments after that, we will. But other than that, all programs are working on a maintenance of effort budget. The only difference between that and a flat budget is that if you have fixed expenses that go up every year, such as contracts, or it might be your software, those kind of things, we're adding that in as a maintenance of effort rather than just trying to find that in the budget. So that's what we're doing right now. It's a maintenance of effort budget. And there'll be a lot more to come as that gets presented to the county admin. And then they'll have their budget retreat again to go over it and go over the updated financials for the whole county. And then we'll see after that if there's any changes that we need to make.
And why was the decision made to do it that way? Is that just Board of Health or just?
That's for
it's
for
everybody. Okay.
Yeah, so it's not specific to us.
Great.
Okay.
Any questions from folks on this? John, anything to add from the legislature's perspective?
I think our tax revenue has been relatively flat. Some increases in certain months, but we're going to be pretty conservative so that we don't raise people's taxes
Okay.
to an overly unaffordable amount. The other thing too is that the legislature is keeping our eye on SNAP benefits and Medicaid and what that's going to look like next year. I think some of the conversations also have been if the state would supplement it, if the county could supplement it, and I think that gets really hairy. One of the things that we're talking about in amongst the legislators is the work requirements that are coming down and what that looks like for our constituents who might have things going on and might not be able to obtain those work requirements. So.
Questions?
You know what, I do have one other announcement. So I'm on the Public Safety Committee. One of the conversations that we're having is based around the illegal cannabis stores that are opening up around town and that have been open, not selling licensed product. And I think Holly Mosher's on the call here, but Maury, who is our county attorney as well, we're talking about ways that we can essentially go after these unlicensed stores where it would be us filing against the landlord of the property. So it would kind of be outside of the Board of Health, I think is the way that we're doing it, because the enforcement mechanism going through environmental health is really gray. And we want to do something that will shut down these stores kind of ASAP, go to court and make sure that they don't reopen.
Providing an opportunity to sell license.
Can we actually hold on this conversation and talk about it when we get to environmental health? And let's come back to it. I made a note. Okay, let's talk about it relative to that. All right, anything else on financial summary? Okay, so I have it down. We're going to
Yes.
when we get to EH, we'll do that. Okay, Dr. Kintack.
Good afternoon.
Good afternoon.
Nice day. Second in a row. It's all up.
There is.
So, I resonate with your message about Medicaid. It's, people who aren't taken care of now, as I pointed out in my report, come back for care when they're much sicker and cost a lot more to take care of. So from many points of view, it's very good to make sure that people have access to care. So on another cheery note, in avian influenza, we really haven't had a lot of notices come out in the public health sphere about it. Not human cases arising. Cross your fingers, it stays relatively quiescent. The latest study that I saw was one looking at dairy cows and immunity, and a study in which they artificially inoculated them with virus, and then were able to demonstrate some immunity that was achieved thereafter. Whether that opens a portal to dairy cow vaccination or not, it depends on a lot of other studies being done, but that's the good news about avian influenza. So, any questions on my report?
I actually just wanted to hear a little bit more about the oral health project, just because we've talked about it quite a bit at the board. And you were talking about the regional partners being extensive and that you've had lots of individuals that have signed up to explore solutions. So what does that look like in terms of next steps? Are you forming like a work group or?
Rachel probably has her finger on the pulse of that.
Okay.
Quite considerably. We have a shared document of members that have indicated interest so far. We have work going forward and setting up a first Zoom meeting date. The thing we don't have, well, we do have, thanks to the interest of the executive director of the 6th District Dental Association. He's willing to participate with us on this project. We have as yet to identify a local dentist who's willing to put in a little bit of time. But, oh yes, right, you're reminding me. Rachel, you speak up because you know the information.
We did get an email from Dr. Patel, Amit Patel, who's a local dentist, that he is able to serve on the coalition, but not until a little bit, everybody's got a busy June, it seems like, so we're looking at our first meeting in July. Likely, but we have a nice list of, school nurses, someone from the Ithaca Free Clinic, a lot of interested partners to join with us and talk about, especially the access issue for children who are on Medicaid, have access to dental care. Right now, most people are going out of town.
I think that there was a concern a few years ago that there was one provider in town, and whenever people went to that provider, they received really poor care and unnecessary dental treatment. And so I hope that has also been the discussion as well.
Mm-hmm.
And there's been either an investigation by Medicaid or something, because people were choosing not to go to dental care because they didn't want to have all their teeth taken out.
That's true. Yes. I think, there's several providers who accept Medicaid, and that seems kind of dependent on when you call and say, well, I have a child who needs to come in. Some of them will say, I'm fine and see them for basic, but not anything significant, and others will bring them in. So it seems like a changing landscape a lot. So that's one of our goals, is to nail down what exactly is available in the county and get that out.
Thank you. So back to you, Jeremy.
Okay. One update is, we've talked about the fellowship program and having it be extended through the end of the year. And during our meeting at HHS last week, while they were voting on it, during that same meeting, the state was saying that it will be extended, but without an end date. So we do not know still when that end date will be. They're hoping maybe get through all the way through the end. But at this point, I've talked to a county admin. We're still going to go through the process of having those funds allocated just in case, because we may not know when the end date is until it happens. But it's going to be significantly less every month that goes by that is still covered by the state. So that has been approved through HHS. It'll go to the full ledge. And once they give us an end date, we will refigure all the expenses and give that information back to county admin and to the legislature to say, here's what's left of that. So that was good news. Great. I wish there was a actual date, but. Do you want me to do the presentation?
Yeah,
now?
so you don't have to do that. So just for folks in the Board of Health packet at the end was PowerPoints from the whole health integration and kind of where we were and where we are now and where we're going. So this presentation was given in a longer version to the legislature. And so that'll be available for us to watch. But I do want Jeremy to just hit the high points with us in person so that we're able to ask any questions that we may have. And also because I think it was informative for me because I needed to see like we keep talking about it here, but it's important to see visually like where we were and where we are now and be able to ask some questions about that and where we're going in the future, especially given that we will have a new commissioner in place here shortly. So with that, if, again, it doesn't have to be the entire thing, but if you can just kind of walk us through the high points here about.
Sure. Just get by.
About the integration.
Sure, okay.
And it's in your it's in your printed packet too, if you need it, starting on page 24.
Yeah, so I've got my screen shared. You will get a link to the recording as well as soon as that is out. So once that's out, I'll share, but I'll try to streamline this into 10 instead of 20 minutes. And then you guys can ask any questions that you have.
Great.
All right. Let me just reset my screen so I can see too. So I wanted to set the stage first and remind everybody what we are doing and why. One of the things that I appreciate most about working for Tompkins County is that we didn't just integrate to save money on a commissioner. We integrated because we saw a need to treat each individual as a whole person, rather than please go downtown and engage with mental health and then come uptown and engage with some physical health here. So we had that goal right from the start, which is great. This was not just about saving money. So in the past, clients would have to jump over the barriers that are built into the system. And really what we have found as we go through this is that there may not be one perfect licensure that just allows all of us to be in the same room doing services for one client. There might be some overlaps that we can do and some others that we can't. But we can shoulder the burden of the regulations rather than the client feeling it. So rather than them filling out multiple intake paperwork, rather than them retelling their story over and over again, we wanted to say we can hopefully shoulder that burden. Prior to this, these two departments would not have talked to each other, right? Prior to 2019, those two departments, the two separate departments of mental health and public health treated each other like we were completely distinct and separate. We didn't have programs that were talking to each other. We didn't have department heads that were talking to each other. And we didn't have service providers that were talking to each other. And so really we came about it from that perspective. Now there was a lot of things we're gonna have to jump over for the state to just get any of this to occur. But we wanted to make sure that that was at the center, that better client care for better outcomes was at the center of this. So that every move we make, everyone we hire, everyone we brought on, I'm giving you all the same spiel I give to everyone I hire, essentially, is there's a reason to be here, that it's really important work and that we want you to put the client first. And when they're in your doors and someone down the hall from you can help them, that you don't wait to see when they could possibly help them, but do it now, right? Make the call, make the referral if you can. So by collaborating, we're going to hopefully maximize those outcomes. We've also seen a great deal of capacity building by integrating, right? So if someone comes in to see a provider for EI, and that family needs mental health services, and that family needs WIC, and that family needs immunizations, whatever, needs a community health worker, all of those things, we have greater capacity to help that person sooner now than we ever have, right? We can make those referrals quickly. We can hopefully suggest to that client, this is really important. And you can do it in this building. We don't have to set you up to go to another place. We don't have to set you up with 4 more appointments. That's what we're trying to avoid. Let's see if I can get this to go. So that's where we were starting from. You're not really meant to be able to see all of this, but this is two distinct organizational structures, right? That's one side is public health, one side is mental health, and this is where we started back in 2019. It became really clear that this structure was never going to work for us to be able to really integrate. So the first thing we had to do was reorganize. And one of the most important things that we did was reorganize so that the whole health commissioner doesn't have to be specifically a public health director or meet the needs for the mental health side. This person is supposed to keep the high level view and then keep all the rest of us going toward that vision, right? So they're providing a vision. They're looking into the community to see what does the community need, and then how do all of these services fit in there? So that someone is driving us toward this collaboration at all times, because the system is always trying to suck you back. The system doesn't really allow for this to happen smoothly. Public health and mental health will always just treat you like that side of the house. If you want to be collaborating, you have to keep pressing hard. You have to intentionally keep collaborating. If you don't, Medicaid will pull you back. New York State restrictions will pull you back. So someone has to keep that high level view and also be the person that brings that to the community, that says, why are we here? Why is it different? Why is it better? Why are these services great? Why should you be working together with ours? So that was the first thing that we did. We put 3 deputies underneath that commissioner so that everyone's voices were heard, right? So you've got the public health, you've got the mental health, and then you've got a financial deputy essentially that can bring all of the voices from all the programs forward and say, here's what we're facing. But there's a baseline approach but you'll be collaborating with each other now, rather than trying to do it on your own. So both a loud voice, but you have people that you can work with and start there. So when I go to this next one, this is the current structure. And the current structure is all under one. And again, I don't really want you to be able to read this all that well. It makes us look like one big thing, and that's the point. We are now one big thing. There's a whole health commissioner, and then there's 3 deputies, and then it goes down from there. But a lot of these people now sit in offices much closer than they ever did. They now know each other's names. They now know about each other's services in a way that prior to this would have never occurred. I remember I was here before we integrated. I didn't know a single thing that happened at public health. And I know my commissioner at that time also didn't, right? Didn't have a clue. And so just the fact that this structure is in place allows us for some of the improvements. So there was some natural sort of organic improvement that happened when you put the structure in place. There's a lot more work needed, but that gave us the sort of bedrock, the baseline to be able to build off of. We'll just keep going because I know.
Are there other counties that are doing similar?
Not a lot. There was one that did it and then undid it. There are some that I've spoken to that it's in name only to have a commissioner, but they still treat the services very separately. If there are some, I don't know. I don't know what they are because a lot of the ones I've heard of, they tried and it didn't quite work. So while and hopefully you can read this better in your packets than you can on here. This is just some of the accomplishments. I wanted to draw your attention to some of the things that have occurred. This is even smaller for me than.
Getting older.
Yeah, I'm getting real tired. One of the biggest ones I wanted to draw your attention to is that first section, which is improved client services. Much of the work we've done so far has had to be administrative to get all of that baseline I was just talking about in place. But we've now already switched to improved client services. And the first thing that I draw your attention to is the brand new Brown Road Mental Health Clinic. So since that opened in November, it's the first time that you can now come to one building and have the potential to see anybody that you want to see, right? And so now I've asked, and staff have been sending me stories each week essentially about, I took my client across the hallway and we were able to get them better services. Or they weren't going to be able to get mental health services unless 2 providers went out together and then they were able to get mental health services. Those kind of stories. So we're sort of trying to build on with both the staff and the community. These are successes. This is why it's better. So we're having staff tell each other that. We're having hopefully clients start to tell each other that so that people engage better in these services. We also created a referral system. This is what we gave ourselves to make it easier that now that I trust you, right? Now that I've gone and seen your program. You've educated me about that program, and I want to send my clients to your program. We needed an easy way to do that. And so we built a system where you essentially can check a few boxes and emails get sent to everyone that referral should go to. Not a perfect system. So we have a group of people, a committee that actually reviews referrals every single month to try to make sure that that's going well. And we actually ask each other, okay, this referral was made on this date. How is that going? How has it been so far? How can we improve upon it? Right. So we have this intention of giving you a tool, but also following through to make sure that the tool works well for you and that the services are working well for you. Let's see. I've talked about that. We've talked about leadership, administrative oversight. One thing I'll highlight is all administrative functions are now done by one team, and that is a pretty monumental feat when you consider that that team has to know all the regulations now for DOH and mental health, right? So we now have a team that supports the financials, the payables, the reporting, the billing, all of that stuff is now done through one team. And I just want to give that team credit whenever I can because it's a huge amount of work, but we did not end up hiring necessarily any more staff to do that, right? We just built a team, wrote new job descriptions to make sure we could, and have developed this team over time. Public information as well. Mental health was always hard to get information out about, and we did not at Mental Health have a team that was public information officers, right? There was no one doing that for us. And now that's been a big add so that when information goes out as whole health, and it can go out about any topic that whole health wants to send information out. Staffing and budget considerations, that list there those are all positions that we either wrote new job descriptions for or created, but did not ask for any more legislative dollars to do so, right? So that was sort of our reorganization, noting that we had significant gaps. That data analyst, we have an HR person now, we have a planner now. We have a billing coordinator that can bill for multiple programs. Those are all things we did not have in the past, and a skill set that we didn't have in the past that now we do. Quality assurance and improvement, we have a whole unit now for that. Prior to this, we didn't have any. They do things like clinical reviews. They make sure that we're set up for audits, make sure that when someone comes in to license us, that we'll be in a good place. They're pretty important, and we're a big missing piece. Sorry, my screen's getting covered up. And then planning, right? The two departments, this is the last section here in purple, the two departments historically would have planned separately, right? They both have plans that they have to submit to the state, and they would have been done separately, not necessarily informing each other. And we've come a long ways now that the same staff can work on those plans, right? The same staff can know what's on the other plan so that they can inform each other. They may be on different timelines, but at least they're informing each other. Rather than 3 years later, we found out, oh, we were working on the same stuff, except we didn't do any of it together. We sort of looked elsewhere to figure out how to do that. Let's see. Cross-functional teams I've spoken a lot about with you all, so I'll skip that for now.
And Jeremy, let me
Yep.
just stop you there, just in interest of time too. So that's kind of the background of where what integration has occurred so far. So I wanted to just stop and see if board members have questions. Frank?
I see. I mean, you noted a mental health clinic here, then corresponding presence of public health downtown.
We have done some clinics downtown. Long-term, we have our eye on the empty 5th floor. That's where we would really like to have an integrated section in our building. Right now it's vacant, but as the center of government rolls out, they may need temporary places for other departments to be. And it does sound like our 5th floor might be taken for that, but we do have plans to put forward that will say that is our integrated section down at Green Street.
Is there a community health worker? Will be located down? I remember hearing about it, but
There's office space, but so the potential and opportunity is there.
Any other questions, comments? Okay, so I'm not gonna have you do the rest of the presentation, but would just encourage folks to watch. And then Shauna, I guess I just have a question, what the reaction was from the legislature when they saw it
I think it was good for everyone to see because, I mean, we made this decision 3, 4, maybe 5 years ago. It was before COVID. Yeah.
Yeah. We launched
Um,
2019,
yeah,
so. it's
yeah.
funny.
And it was really good to see the work and I think the specifics of what people are experiencing. And we've heard from our constituents how they like coming up here and not downtown, how they can come here for counseling, and then walk across the hallway and go for WIC counseling. And so I think people are definitely using it and using it more.
Thanks. Okay, so Jeremy will send out the Zoom link or something well, so that you can watch the entire picture. Okay, let's just keep moving. So Rachel, you up next. If you have anything, yeah.
Nothing to add to my report.
Okay. Any questions on community health? Okay, Sam. Okay, so I just want to take a really quick pause to make sure everybody knows that this health department was well recognized at the New York State Public Health Association meeting, which was sort of alluded to in the report, but I'm not sure we captured everything. So I just want to make sure I say it here publicly, and if I missed anything, let me know. One was that Frank Krupa was recognized for, I don't even remember what now. Sam Hilson was recognized for, I don't even remember what now. And health promotion team was recognized. Sam was the one that was on the stage.
Contributions, like public health contributions.
Okay, thank you. And then one of your health
Segregated.
fellows was recognized as
Yeah.
well, right? Okay.
Yeah, she was one of 12 fellows across the state that got like a fellow, recognized as a public health fellow, significant excellence award.
It was great. So, and did I miss any other recognitions that occurred? I think those were the 3 that I saw. So wanted to just say congratulations and a job very well done. And it was really great. Yeah. And that was so well recognized at the event. So thank you for that. Space to say that. Okay, so any questions for Sam on her report? Okay. Jessica for children with special healthcare needs. I did want to just, so the is this the SLP we just hired? Okay.
Yeah.
And so what's the game plan for that?
The position's been posted as soon as she submitted her official resignation. We
Okay. So then that just means the wait list just grows while we. Okay.
She had previously worked in research, and she determined that she's interested in that direction.
So there wasn't anything that could have been better here for her.
No, I actually asked her when she resigned, I said, give me all the feedback, because you were our first provider here, so I want to know, what went well and what didn't go well, and she had positive things to say about that.
Just a mismatch for what she.
Yeah.
what she wants to do. Okay. Okay. All right, that's too bad. That was, we were making progress. It's like 2 steps.
So our special education teacher is building her caseload, and she's almost at her full caseload, so that's wonderful.
Yeah, good. Okay, great. Okay, environmental health. Elizabeth.
I don't have anything to add.
So can we revisit Shauna? What you brought up. So the Public Safety Committee is thinking about or has passed legislation.
So I don't even think it would be for anything for us to pass. I think it would be
Okay.
guidance for us to tell our county attorney that we would like to move forward with shutting down illegal cannabis stores. And it sounds like it's more probably Holly and Maury that are gonna head that up. I don't know, Liz, is environmental health gonna be part of that, or is that going to the sheriff's department?
Environmental health is not part of that.
Okay,
Assuming it's going to
okay.
go through the sheriff's.
Oh, there's Holly.
And when this is just limited to cannabis, not illegal vaping. stores.
Yeah, that's right.
How many are there?
I don't know.
Like hundreds or?
I don't think so.
Right.
I don't think so. And I think
It doesn't.
what we discussed was that once we shut down the stores, it's not like it's going to be recurring. And so it's going to be a mass, a large amount of work at the very beginning, shut them down, and hopefully like one or two popping up here and there.
And Frank, what was your question?
Will there be an opportunity for them to go on the other side of the coin and provide licensed materials in lieu of shutting down? Or being shut down?
I don't know the legal specifics. Because I know a lot of the people that are dispensaries now have to go through a whole process, spend $15,000 for a license and
Okay.
have to go through certain growers and that there's a whole long process that used to take 6 months to a year to get a license.
Sure.
Holly, do you have anything to add on the process and where we're at in that?
The process in implementing the eviction law, which is basically what it is. I haven't had an update from Maury on it. I mean, I do know that the real property actions and proceedings law provides for it. We would give the landlord notification that they need to evict that tenant who has engaged in unlicensed cannabis sales. And if they don't do it within 5 days, we can do it for them. And we would just file a petition with the court, go to court, and the judge would issue an order of eviction.
Why was vaping not included in this?
Well, the specific law is the Real Property Actions and Proceedings, section 715A, and that's very specific to unlicensed cannabis. There is another section, just 715, where you could do a similar type of action if there's known criminal activity, and the flavored vapes are, I believe, more like a civil. It's a civil penalty through. I mean, they're not supposed to be selling them, but there's also no criminal action to bring against them for selling. It's a fine, so it's a civil action that we bring against the stores who are selling flavored vapes.
Thank you.
So is that just selling, or selling to a minor is actually the criminal? Is that right? They're two different things. One would be selling flavored vapes, and then if they sell to a minor, that's actually criminal?
That would be a question for Matt, I think. I'm not really sure if selling to a minor is certainly illegal, but nobody's bringing a criminal action against them, is I guess what I'm saying.
So Holly, so under our TUPA law, it's not a criminal action to sell to a minor. It's still civil. Is that correct?
We're bringing civil actions against them, yes. Which then, by sending it to the state for the selling to a minor, then the state takes their action in assessing the points, and then they get suspended eventually. But we handle it civilly. I think Matt was asked maybe one time about selling vapes to minors, and I'm not really sure. I think he said, maybe like staffing, or that it's not something that they can really take action against. I'm not really sure.
I think the other part, whenever we brought it up in public safety in regards to the illegal cannabis stores, it sounds like something that our DA is not willing to go after. So this seems to be the better route.
That was my understanding as well.
Thanks.
Anything else? So, Frank, any more questions? Any questions from any other board member? Thanks, Shauna, for sharing that. So, and using a TUPA as our segue into our enforcement actions. So we've got one enforcement action as part of our new business. So I am looking for a motion to approve as written. I have a first I'll take the first from Ed and a second from Melissa. So let's go ahead and open this up for discussion. And actually, as a starting point, Liz, I wanted to just make sure we were centered on I actually wanted to start with the penalty because I think some of the penalty relates to what we have to charge, right, under New York state law. And then, so can you just walk us through the penalty first before we?
So the penalty is $1,500 for the sale to a person under 21.
Right.
That is the maximum we can charge for an initial sale. There is a minimum, right? This is the maximum,
Right.
and then there is the 250 surcharge per violation is what we cannot change. Then they also had 7 flavored vapes. There is a maximum of $100 per vape product. So I don't believe there's no minimum for the vape products. So the penalty is set at the maximum amount for both violations.
And so just for consistency purposes, that is the direction the board has taken on previous similar violations.
Under their policy.
Under the bus, right? So that's where I wanted to just start so that we were thinking about that relative to this. Okay, so any other items for discussion on this that we'd like to talk about? Yes.
I'll just say I'm glad we're doing the max. I hope we continue to do it. And I hope that these places it costs them because them preying on our kids is really not something we want in our community.
All in favor? That's unanimous. Okay, so that's our enforcement action.
Okay, so I'd like to make a motion to go into executive session to talk about the commissioner search.
First from Melissa, second from Lavender, all in favor? Okay, we're gonna go into executive session. We'll ask all staff to leave and we are going to go off the live stream. Oh, we didn't go through. Thanks,